Hello, everyone. I'm Anka van Gastel, and I'm going to tell you something about the impact of diabetes on the lives of young adults. Wait, how do and yes, good? Yeah, I'm a bit higher. Yeah, perfect. Yep. Myself. Okay, there are no conflicts of interest. Um, and oh, this one changed. Okay. Okay, so young adults face age-specific challenges. I think you can all remember moving out of your parents' house, starting your college life, maybe start your full-time job, engage in romantic relationships, or even start a family. So young adults with type 1 diabetes also need to maintain good glucose levels. Next to that, as Ilko previously mentioned, trying to stay away from the hyper and hypoglycemia. And we saw that young adults have worse medical and psychosocial outcomes in comparison to other age groups. This could be because of trying to fit their diabetes care into their ever-changing lives. So we try to assess the impact of diabetes care on the lives of young adults with type 1 diabetes. And we did this through a cross-sectional online open survey with Dutch young adults between 18 and 30 years old with type 1 diabetes, which we recruited through hospitals, diabetes organizations, and online portals. And we used the measurements of the treatment burden questionnaire in which we measured the treatment burden, and a higher score is equal to a higher experienced treatment burden. And based on a previous research, we found that they found that an unsustainable treatment burden is experienced from a score of 59 and above. And an unsustainable treatment burden means that they feel they cannot put in the time, efforts, or energy of their treatment for a lifelong period. Then we also looked at the diabetes-specific quality of life, which we measured using the type 1 diabetes and life questionnaire for 18 to 25 years old and 26 to 45 years old, in which a higher score is a higher quality of life. And next to that, we also had self-reported situations of when care did and did not fit well. These were open-ended questions, which we inductively and deductively coded, double-coded in one of the 9 making care fit dimensions Marleen mentioned before. So just to recap, for care to fit, it should be maximally responsive to patients' unique situation, their priorities, while being minimally disruptive to patients' life and social networks. This requires collaboration in the content and manner, and this is an iterative and ongoing process of unhurried conversations. We ended up with a sample of 294 participants, which were about 25 years old, and most of them were female, high educated, and employed. Had a diabetes diagnosis of about 12 years. They used an insulin pump most often, and almost everybody used a sensor for their glucose level monitoring. And about 17% had a high average glucose level. So for the treatment burden, we found an average treatment burden score of 59.6, which is about the same as we saw in a previous study about among diabetes in all ages. But more interestingly, we found that for the whole sample, half of the sample experienced an unsustainable treatment burden, and this is more than twice as high as for the whole group of people with diabetes. Then we also looked at the quality of life for type 1 diabetes specific, and here we found a score for 18 to 25 years old, 56 out of 100, and 26 to 30 years old, it was 62 out of 100. And I think which is most interesting is that emotional experiences and daily activities were scored lowest in comparison to all other dimensions. For situations of when care fits well, we found the following subdimensions most often. First, continuity of life. This was mainly about having a routine into daily life, which made it easier to fit their diabetes care in their lives. And then next, we had relationships, patients, and social networks. An example you can see here in which participant explained how her boyfriend was a big support in trying to fit diabetes in their lives and just struggle with diabetes overall. And then we also had influence of devices in which technology also impacted making care fit in their lives well. Then situations of care that fit not well. First, we saw impact of life and condition most often. So this can be the impact of life on condition, for example, having busy work days and then forgetting to administer insulin. But it could also be the other way around, in which the impact of condition on life, for example, with the second part of the statement, in which participants stopped their exercise because their glucose levels weren't good enough. Then again, we saw continuity of life. And in this case, it was more the lack of having a routine. And then lastly, we had problematic situations. This was when there was not a clear or easy solution. For example, in the statement, you can see that a participant mentioned that emotions play a significant role in their glucose levels, and it can even make her feel ill when this is for an extended period of time. So a few limitations. We had quite a small sample to really make a difference between, for example, the technology they used. Next to that, we had an overrepresentation of women, and we didn't really have insight into what daily activities they really did. However, tomorrow I'm also presenting a poster about the photo voice. I think Marleen also already mentioned this. So I invite you to come have a look and show you a bit more about their daily activities. And then lastly, we found a high treatment burden among young adults with type 1 diabetes and moderate diabetes-specific quality of life, in which emotional behaviors and daily activities was scored lowest. And this suggests a high impact of diabetes on the lives of young adults. Topics for improvement and good examples can be found in participants' reported situations. And impact of diabetes on the lives should be taken into account when designing care plans with the young adults to make care fit into their lives. Thank you.
We have some time for questions.
Hello. Yeah, good presentation. Thank you. You got a lot more women in the study than men. I wondered why that was, and then also if you could, obviously this isn't evidence-based, but I'd be curious to know your hypothesis of what it would be if you'd got more men into the study.
Yeah, this is actually a really good question, because we also looked at the differences between.
Microphone.
Yeah. Oh,
It's hard to hear in the back.
oh, sorry. This is a really good question, as we also looked at the difference between men and women. And we found actually that we had about 44 men in the sample. Still, we found a significant difference between the treatment burden score outcome between men and women, in which women scored a higher treatment burden than men. So I think it influenced it a lot. I don't know why more women responded to this survey. Maybe they felt like they needed to be heard more, and that's why they wanted to do the survey, or because it's a really big problem for them. Yeah, but either way.
Guys were playing video games.
Thanks. Did you look at any differences in perceived burden based on age of diagnosis?
Yeah, well, we have looked at it, but we didn't really see that much of a difference. And when I speculate, I'm not for sure if this is the case, but I think it has to do with their life is changing all of the time. So they have to try to fit their diabetes care in their life, even though it changes, something changed. So I think it still is, even though they have a longer onset or they have diabetes for a longer time, still have to try and adjust to their diabetes care into their life, which changed.
We have time for one more question if anybody has one.
Presentation. Thank you for that. I do have a question more on what your thoughts. do you think it would be relevant to see which one of the like stressful situations would be like affect more in like with the patients, for example, like moving from one place to another would be relevant to identify which one is the one that affects them the most in their control? Like what are your thoughts on that?
Yeah, I think that would be very interesting. What I'm also thinking, what might influence that as well is next to that, what is happening. So, for example, if somebody is going to college but he's still living at home, it might like they have a bigger support. Could be that it's like there are a lot of other things, like maybe also capacity plays a role in this as well. So it would be really interesting also maybe like at what point, what would influence it. But yeah, good idea.
Okay, well, thank you very much, Akta.
Thank you.